Can everybody see my screen?
Mhm.
Awesome. Welcome to the Anthem Challenge. My name is Sasha Goodfriend, and I'm here with people from Anthem Exponential Technologies and Anthem Corporate to help you succeed in our challenge. The purpose of the challenge is to imagine and build a new kind of medical system, a new kind of healthcare system, a new kind of medicine in our country, a personalized digital medicine in the age of COVID and beyond. Today, I'd like to tell you a little bit about Anthem and then jump into explaining our challenge. Our reason for being here in the Exponential Technologies team is to improve the health of humanity, democratizing healthcare, empowering everybody to take control of their health, giving equal access to affordable and convenient care. In other words, build an entirely new healthcare system that is far beyond the traditional medical model, to disrupt this entire industry from the ground up. It's a big challenge, and I think we are at the starting point for actually making that happen. That's why we need your help. This weekend, we are going to put the building blocks towards that new healthcare system, new medical system. Let me tell you quickly about Anthem overall. Now, Anthem is an S&P 500 company that provides medical care, healthcare to 1 in every 8 Americans, 42 million people. We have a massive presence in 14 states, including Georgia, California, New York, Indiana, and others, and presence in every other state as well through various subsidiary companies and members. I, for example, live in Chicago. Anthem has numerous companies as subsidiaries, companies that provide specific, targeted, smart, pioneering medical services, such as prescription drug coverage, mental health, and many others. It has been awarded multiple awards for diversity, for equality, for being friendly, a great place to work, and so forth. And so we are very proud of that. But at the same time, we're in the Exponential Technology team, we're trying to reimagine that and think about how to build this new healthcare system. I'd like to introduce Ketkis, who will tell you a little bit about an app that we've launched last year. Ketka, are you ready?
Yes, thank you, Sasha. Hi everyone, my name is Ketki. I'm one of the data scientists in Anthem Exponential Technology from R&D Group. Our key product is our Signicare app. I'll surely post the link so that you guys can download the app and enjoy the experience. So our initiative basically is towards implementing a symptom checker and easing out the accessibility to healthcare to overall population. So being a student, you must have experienced that if you want to go to the doctor to show what you're going through and get some consultation, then obviously it takes a lot of time to first of all get the appointment, especially if you're a new patient. So just to combat all these challenges, our initiative is our app, where you enter all your symptoms that you're facing at this point of time, and it will give you the potential diagnosis of what has happened to you. Post which, it also allows you to go ahead and have a televisit with a doctor, and that way our initiative is basically to make healthcare accessible to all and make it easier for everyone to access it at the same time. Can we go to the next slide, please? So today, if you see, overall the market is moving towards digital era. So in the healthcare industry also, the initiative is that we want to introduce digital features as much as possible to alleviate the experience. One of the feature being said that is a personal virtual health assistant, where you have a system that you can interact with, which is very intelligent to understand your needs and what you require to provide the best care. Then you would obviously want to have it handy, especially in the situation like pandemic, where we cannot easily go out and meet with the doctor. So it would be so nice to have a capability to speak to your doctor on video, or have some kind of interactivity with the clinicians that you usually consult. Not only that, but also to get the medication and other type of uh, things that you require. So, for example, when it comes to purchasing the medicines, it would be so much nice to do it at fast, and then you have everything ready on your phone. You show that code to your pharmacist, and they have all your orders ready. So basically, we are really trying hard to change that experience and bring a lot of digital features into the healthcare. So our challenge today is to focus and see how this can be done. My colleague will speak more on that. Thank you.
You probably heard that healthcare is expensive, and here's some data. This is data that goes back to the 60s. You can see how nationally we have been spending an increasing proportion of our wealth on healthcare expenditures. And the trend is only expected to go up and up and up. By 2028, this organization expects that 20% of GDP is going to be in the healthcare system. This is not sustainable, and it's making people lose their, lose their income to pay medical bills. That should not happen. So our goal is to figure out how to build software, to use data in order to make healthcare much more affordable, much more efficient as well. So let me tell you a little bit about our challenge. Our challenge is really fits in with all that we described, what Ketka described and what I described. We are trying to be part of that disruption, to solve one of a million different problems that are affecting healthcare today, to solve one of them. And that's our challenge to you, essentially, to find one problem in healthcare that you can solve with software. Let me tell you the details here. Our challenge is summarized in this sentence. We are looking for personalized digital medicine in the age of COVID-19 and beyond. And what we want you to do is to build a prototype or a minimal viable product, an MVP, which will be a personalized digital medical solution for our day and age and for the future. There are many different areas where you could make your solution. For example, your software or your prototype could be a medical solution for COVID, something that's very specific for the COVID situation. Secondly, it could be a solution that provides digital delivery of medicine. For example, what Ketka mentioned was the ability to talk to your doctor through teleconferencing. But there are so many other solutions that could be done. Apps, could be AI, it could be something else entirely. You can also think about making the medical system overall more efficient, reducing costs, reducing the administrative burden, reducing the paperwork, reducing some of the intermediaries to make it a more efficient and effective experience for doctors and for patients. Another direction that you could think about is to make medicine more portable and variable. Rather than having to go to a doctor, perhaps the smartphone in your pocket is enough to provide a medical service. Perhaps it's enough to help somebody control their diabetes, control their heart condition, and so forth. So this is all oriented to people who love working with devices and sensors. We now have increasingly powerful wearable sensors, whether smartphone or specialized devices, and making them available to people could be disruptive and revolutionary. You know, and we are open to other innovative ideas as well. So really part of this challenge, we asked you to think together with your team and construct some ideas, construct different solutions that will be in one of those categories, and then pursue one of them, pursue one specific solution, one specific MVP or one specific prototype. Just to give you another set of examples to think about, a project might be, for example, an app to support people with a specific mental health diagnosis. And there are many hundreds of different types of mental health diagnosis. Imagine if there was an app that helped people that had that particular mental health diagnosis. You could probably take that app and raise money off that app. So that could be very disruptive, and it could be potentially very impactful. You can also imagine of some kind of an AI technology that helps people deal with COVID-19. In fact, this is the functionality that's already available in our app, but there's almost endless things you can do with the current pandemic. We are also interested in seeing projects that offer new functionality to an existing healthcare-related open source project. So you can look for existing apps or data sets and make them better. We provide you actually with a whole list of sites where you can find such projects, code that you can take and improve. You can think about maybe an app that simplifies buying medical insurance or paying medical bills, or perhaps making a novel use of a wearable sensor. You can also imagine looking at the data and taking a data set and mining it in some unique way, making a previously unexplored health data set usable, available, and insightful. We are also looking to any open source ideas. So perhaps you want to create an open source middleware piece which will make building other solutions better. That is another idea of a project. And so list goes on and on. So this is just something we brainstorm off the top of our head, but we are open to really anything that you can do. And we are going to give you all the resources that you need, and we are going to be here all weekend to help you build that awesome solution. Ketki, do you want to mention something about the mini challenge that is going to be out tomorrow?
Yeah, sure. So, being a student, maybe it is a possibility that you guys have not worked a lot with the clinical data. But what happens is, whenever you do have a particular diagnosis, or if you go to the doctor for a particular reason, then when they send you the bill or when the claim is filed with the insurance company, these complaints that you discuss with your doctor and for whom they treat you, they are always encoded in certain coding schemes. Now, this is to avoid all the confusion and keep everything in the canonical fashion so that the standardized terminologies could be understood for clear billing purposes. And these codes have certain formats for encoding. So one format is called SNOMED and the more granular format is called ICD-10 code. Our mini challenge will provide you with the data and the corresponding supporting material where your challenge is to map these SNOMED codes to the corresponding ICD codes. And the reason why you have to do it is because SNOMED is moreover like a broad spectrum of terminology, but when it comes to ICD-10, they are more granular. So they take care of your age or some another rule, or if you have some another condition that is being observed. Obviously, the entire treatment is going to change based on so many additional factors. So that is the reason why we require one-to-many mapping. And your challenge is exactly the same. You have to perform this one-to-many mapping for the data that we would be providing you in the mini challenge, and come up with a software solution where your system can implement, given the input, your SNOMED code and the rule or observed conditions. Your system should be able to um, output the corresponding ICD-10 code. And I'll be available to take all your questions tomorrow when the challenge will start. So yeah, looking forward. Thank you, Sasha.
I would like to introduce Guido, who is going to tell you about how to win the Anthem challenge and all the resources that we have for you. Guido.
Yeah, thank you, Sasha, and thank you, Kathy, for the information. This is Guido. I am a senior AI engineer in exponential technology R&D team. So a couple of quick points. I don't want to take more of your time. So on the slide, there is a link, which is also posted on our Slack channel. This is the link to our GitHub repository, where you will have the description of the main challenge, the description of the mini challenge, as well as useful resources. In particular, this resources.pdf document will contain a lot of information that you can use. There's going to be software. If you want to use them, go ahead and use them. There are going to be data, in particular COVID-19 related data, some from Johns Hopkins University. You may have heard of them. And there are other GitHub pages and source code that you can take and use and transform to build amazing solutions for this hackathon. And also feel free to use anything else that you may have in mind. We are open to new solution and new emerging technology. Also, we have a Slack channel. I'm sure you know that because there are so many emails about Slack channel. And then we have an email dedicated to our hackathon, hackathon@anthem.com. Feel free to drop a message, and one of me or my colleague will answer this message as soon as possible. Go to the next slide, please. So, judging criteria. First of all, innovation. We want to see something new, something that has not been done before, a unique solution. It doesn't need to be ready for production. That would be great if you can, but it doesn't need to be. But we want to see new, amazing projects from you and from this hackathon. We are also going to evaluate the viability of your solution, if there is any user value, and we are going to also evaluate the marketing aspect. If you have built a business model, how can we use this solution actually in Anthem to improve the life and the healthcare of our members? Then we are going to evaluate the engineering quality. As you see, this accounts for 20%. We are going to see we want to see an implementation. If you want to create them, you are free to submit a solution that is only a mock-up of your idea. We are going to still evaluate the feasibility of the solution, so be mindful about that and evaluate that by yourself as well. Then we're going to evaluate the minimum viable product readiness. Also in this case, if it is ready for our user, if it is a functional solution, and how can we use it in Anthem. And then finally, we're going to have a final presentation where you're going to explain all of these points. So be mindful and prepare it a little bit more time. I did some hackathons, and doing the presentation in the last 30 minutes is usually the wrong thing to do. Can you go to the next slide, Sasha, please? So to submit your solution, you should submit your solution at DevPost. We are going to provide more information as they become available by the hackathon team at Georgia Tech. But anyway, you should use DevPost. You can create a repository on GitHub and link it to DevPost, and then even send us an email. We're going to let you know when the final instructions are there. But be mindful, it's going to be on DevPost anyway. Next slide, please. So some tips, really quick tips. For the first couple of hours, I would say brainstorm on many ideas. Bring out some project, even some crazy idea. But then it is important that you select one and you stick to it to provide an amazing new healthcare solution. I would suggest to create a working pipeline. If you need data, understand which data do you need, and if there aren't data out there, how you can create this data. You should prototype the solution. As we said before, a mockup is okay. A code is great as well. then analyze the marketing aspect and the business model, and then provide engineering tools. And the more engineer is your solution, the more points we'll get in our judging criteria. Again, a strategy, the engineering aspect and code is only 20%, so be mindful. If you don't know how to train a big neural network, just say you may be able to and provide some solution to that, and we are going to still evaluate your project. And then be mindful again, the presentation is pretty important, so spend some time on it. The next slide, please. So we are providing AWS Credit to the first 25 team requesting it. We still have a couple of them, so hurry up. Each credit is worth $350. It's gonna be on your AWS account, and there are instructions on our GitHub page to obtain these credits. Send an email to hackathon@anthem.com or send me a message on Slack or in our Slack channel, and I will send you a code on a secure email with our email address. Then finally, for the next slide, please. We have a couple of amazing prizes. The first prize is going to be a top of the market hacking kit. Is going to be a new Raspberry Pi 4 with a lot of sensor and a lot of memory for you to develop some other amazing solution. Then for the second prize, we are offering a great smart screen, and then the third prize will have a small drones, and each of these will be for every person of the team up to 4 persons, which I believe it's also the maximum available number of people in a team here at Anthem at Georgia Tech. And then finally, I would say more important, we are going to offer you the possibility to have a luncheon with our exponential technology division. In particular, there's going to be staff VPs, MVPs to this lunch, and the winner team will have a possibility to present their solution on the entire team of exponential technology. And we have one of them, Elliot Torres, here in the call as well.
Yes, and I can confirm that we are going to also provide free lunch coupons. So this is not an empty lunch offer. It is a real lunch offer. If you win the hackathon, we're going to send cash your way to buy any lunch that the coupons cover, which I think we are going to be pretty generous about that.
That's great. Thank you, Sasha. And then some final information. Again, this is the email to contact us. This is our career portal. There are many recruiters at this hackathon, so take advantage of them. Send their resume, speak with them. We are an amazing company. And then finally, again, the Slack channel sponsored Anthem. Every information, you find every information there, and feel free to contact me, Katki, Sasha, or anyone else in this call for more information about the challenge.
Thanks, guys. Kyle, do you want to add a few words? Kyle is our head recruiter.
Hey, everybody. Thanks for joining us today. And Sasha, Guido, Keki, thanks for your time and doing this with everybody. No, nothing that I really have to add at this point. I just dropped a link in the chat if you guys want a chance to win an Oculus. Share your resume with us, and we will get that sent out to you. We'll do a raffle drawing for the winner on that, announce the winner, get it sent out here hopefully next week or so to the winner. We have some recruiters on hand and people that are going to be sticking around that can answer any questions about the challenge. So feel free to hang out and we can get you connected with the right people, and look forward to connecting with you guys all weekend.
Elliot, anything you want to add?
I think you're still muted. You're still muted, Elliot.
Oh, thank you. Sorry about that. So thank you all for coming to our presentation. I was excited to see over 50 people here. And if you have any questions, feel free to reach out to anyone on the team. We're here to support you throughout the weekend, and I'm excited to meet several of you along the way. So enjoy the challenge, have fun, and good luck.
Awesome. I think we will wrap up the presentation then. If you guys have questions, we are here to help you out for the next hour and a half or so, answer anything you got. we have a couple of breakout rooms set up too to get you associated with the right people. So either feel free to jump off mute, ask a question, and if you have specific questions, we'll get you in touch with the right people.